All right, so today we are going to talk about the different stages of the rehabilitation process. So, how are you going to treat those injuries? How are you going to try to have them heal the quickest and most safely? So, this is where it's important to also know this background so that you can choose the appropriate therapeutic modalities. So, things like ice packs when they're needed, heat when they're needed. And using them at the right time so that you're not creating a longer injury recovery or delaying that injury recovery. All right, so what is rehabilitation? So, like I said, it's a process of just restoring function of an injured athlete and trying to get them back to returning to play. So, you're trying to, as an athletic trainer, get your athlete back as quickly and as safely as possible. So, that's kind of the difference I would say between athletic training and physical therapy. Is athletic trainers again have a background in rehabilitation, but we just try to do it in a more not a yeah, it could be considered a more aggressive approach. So your two basic objectives in rehabilitation are preventing that deconditioning. So you don't want your athlete to lose any of the strength. Maybe it's their agility, whatever it is that they had prior to their injury. You don't want that to go away. And then also just making sure that you're also rehabilitating the injured athlete, keeping them strong, keeping them, as quick as possible so that they're able to recover more quickly. So you have different stages of rehabilitation. Like I mentioned, there are 5 of them. Your very first stage is right after the injury happens. So right after the injury happens, you're trying to control swelling as best as you can. That's where you're coming in and maybe using an ACE wrap to help, push that swelling, that blood that's maybe pooling up towards the heart. You're trying to also reduce pain. So those are your 2 primary things that you're trying to control in that moment. Once those have been decrease, so swelling and pain has been decreased, then you can try to go into phase, or not phase, but stage 2, which is restoring their actual range of motion. So if we talk about an ankle sprain, typically with an ankle sprain, stage 1, there's going to be a lot of swelling. You will see bruising. The person might be in a lot of pain. And because of that pain, that whole joint can start to stiffen up. So once you're able to address the pain, address the swelling, then you can ask the person to start doing exercises that are just specific to them keeping their foot function or ankle functioning. And again, this is at any joint. I'm just giving the ankle as an example. Once you have established, that range of motion, so they're able to maybe put their foot into full dorsiflexion or full plantar flexion, then you can have them move on to stage 2. This is where you would then start to incorporate some strengthening exercises, things like maybe calf raises. You could give them a TheraBand so that they're able to work out their ankle in different directions. You might also have them maybe stand on their ankle and balance on it. That can help with like muscle endurance. So once those things have been established, then you're going to progress them into stage 4, which is going to be more functional movement. So it could be that maybe now you're not having them just do TheraBand movements, you're having them do movements that are similar to whatever their sport is. So if it's, let's say, a soccer player, you might have them doing ladder drills. If it's a football player, again, you might be having them doing drills as well. And then the very last stage is where you actually will then return them to practice. Once they're able to practice fully, then you can eventually return them to games, competitions, things like that. You have, again, this little pyramid. So these are the different, steps that you need to take to get to the top to return to play. So you're obviously going to need that full physical examination to determine what is the injury. Again, you're controlling your swelling in the second step, pain, making sure that the tissue is starting to try to come back together to heal. You would then move on to, your range of motion, like I mentioned. Also, making sure that you're able to actually contract those muscles, oftentimes not with just swelling, but you have that pain that can limit that range of motion. But your muscles too can have a signal coming from your brain where it can affect your ability to actually contract it. And that's kind of like a defense mechanism to protect your body part. So just getting that established. After that would be, again, your strength endurance, making sure that you're able to have that reflex reaction. So, if someone were to touch you in your knee, you're able to allow that knee to reflexively react. And then again, you're going to go into those functional movements. And then lastly, back into practice and games. So again, like I mentioned, athletic trainers are intended to be aggressive in their approach, but they want to also be mindful of the healing process and how that can actually limit it. So you're not trying to make the injury worse. That's not our job as an athletic trainer. You're monitoring your patient, and then if you see that they're improving, then you can progress. If you see that the athlete is actually worse the next day, then you might have actually pushed them too far. So you're going to have to go back a couple steps or maybe one step, make sure that they're able to fully complete that. So let's say you're moving on to strength and endurance, which is the third step. You give them exercises the next day, they come back in and they have a whole bunch of swelling. Then you're going to have to go back to that stage number one where you're trying to do everything you can to get rid of that swelling and that sort of thing. And that's normal. It's just, it happens with injuries. It's just if you're not seeking someone who is a professional to treat it and you're trying to treat yourself, then that's where you might not think, oh, I need to go all the way back. And then you keep trying to progress. And then you have this injury that was once, minor or acute, and now it's turning into a months-long injury, year-long injury, something that's chronic. All right, so we're going to talk about therapeutic modalities and how they essentially address treating these different stages. So in different stages, you're going to also want to not only include, things to help with whatever is going on in that process, but you want to also include different treatments, and the treatments that you choose matter because you wouldn't want to, again, use heat on someone who's maybe in stage number one where they have a ton of swelling, because that's just going to cause more swelling. So it's just important to understand when to use these modalities, why we use them, and so forth. So just in general, we've already talked about this, but a therapeutic modality is any intervention used to increase the healing process. So we talked about ice packs yesterday, heat packs, electrical stimulation, massage is even considered one of these. So these are all things that can help promote healing and also allow for that healing process to hopefully happen more quickly and not take as long. So when you are choosing a modality, it is super important to ask, is this modality safe for this type of injury? So again, if we're going back to an ankle sprain, stage number one, somebody has swelling, they have bruising, there's blood pooled at the bottom of their ankle, you're not going to put a heat pack because that's not safe. That's going to continue to cause more swelling, continue to potentially cause more bleeding. So you wouldn't use that one. And then, will this modality contribute significantly to the rehabilitation process and my rehab goals? So if your goals or the process are to get the person back as quickly as possible, again, if we're talking about a heat pack, that's not going to contribute. It's going to probably hinder it, so you wouldn't use that. But that's also kind of similar. I do not believe, and this is me, that you should be icing if you're sore. And the reason why is soreness is a micro tear of muscles. Icing causes vasoconstriction, so it decreases blood flow. Icing can help with pain relief, and I understand that, but your body goes through an inflammatory response when you're sore, and you icing it actually can cause that inflammatory response to last longer. Because when you are inflamed, it's not a bad thing always. If you have too much inflammation, that's where you have an issue, but some inflammation is actually a good thing. It's your body basically reacting to some type of stress. And then also just making sure that whoever is applying a modality is trained, they know how to use it safely, effectively. So as an athletic trainer, especially in a high school setting, I often see, or even on social media, I see athletes or people who are, maybe weekend warriors, CrossFit people. They're all about wearing, they might have like the electrodes, like a portable electrode treatment. Maybe you haven't seen this, but it's something that I see as an athletic trainer. And they'll place it on their body and they'll turn it all the way up. And they'll say, oh, the higher it goes, the better it is. That's not true. They're probably not trained in these modalities. When I was in school, we had to learn all about the different stuff, and I'm not going to bore you guys, but the higher you place certain things does not necessarily mean that it's more effective. So again, if you don't understand treatment-wise what to choose, it's always better to ask someone who's trained than just to try it yourself. So physiologically, what happens in the body is going to change, obviously, due to whatever therapeutic modality is used. So like I mentioned, with cold packs, ice massage, that's going to cause vasoconstriction. Things like heat packs, electrical stimulation, ultrasound, all of those can promote vasodilation because they're heat therapies. So again, you just need to understand what's going to potentially happen to the body with which modality you use and then choosing it wisely. So just some examples of these physiological effects. You can have pain reduction. You can have a decrease in swelling edema. They can also decrease muscle spasms. These modalities can help with joint stiffness. They can help with circulation, so vasoconstriction, vasodilation. They can help to release histamine. So histamine is basically a metabolite that comes when you are inflamed. And so if any of you have allergies, seasonal allergies, you may have taken antihistamines in your life. Histamine is a reaction that your body naturally produces when you have some type of stressor. And again, it's a inflammation byproduct. So sometimes inflammation can be a good thing, but it can also be something that causes too much swelling, that sort of thing. So that's where you would want to maybe reduce the histamine or increase it. Some modalities can help with establishing muscle fiber recruitment. So this is important when, especially people who have surgery on a certain injury, they can lose their ability to basically contract their muscle for a period of time. So there are certain modalities that can allow the muscle to actually contract for them, and then it just retrains their brain and their body to kind of function correctly. And then lastly, tissue regeneration, so speeding up that healing process. Depending on what you suspect in your evaluation, you're going to, again, keep in mind what are the physiological effects of that modality and then determine which modality you would like to use. So if we're talking back to that ankle sprain, you have someone who has a grade 2 ankle sprain. Grade 2 means that they have a moderate tear. It's not completely torn, but they're 5 days post-injury. Your goal for someone that has a moderate ankle sprain is to still try to reduce that swelling. You can use something like intermittent compression, which I'm not sure if anyone's ever seen this, but they do make machines where basically it's kind of like a blood pressure cuff, if you can imagine it. The ones that you see maybe at like CVS or the pharmacy where you turn it on, or even the ones I guess in my classroom where you turn it on and it basically squeezes what it's around and then it relaxes. So this is similar. It's a type of like sleeve that you can place on an injured part and then it like causes compression and then it relaxes, causes compression. That can be considered like a pumping mechanism. So if you have swelling, it can help reduce that. So just keep in mind edema and swelling are the same thing. So if we're talking about decreasing edema, you're trying to decrease swelling. You also have what are called indications and contraindications. So you definitely need to know this for an upcoming little assignment, but your indications are when would you want to use this modality, and then your contraindications are when you should not use this modality. So some of them are serious contraindications and some of them are not so serious, but like ice, you would use that. It would be indicated to use ice if you have an acute injury. However, it would be probably contraindicated to use ice if you have a chronic injury and you're about to play a game. Because if you're trying to go out there and run and you're putting ice on your ankle, that can actually stiffen up everything and then you could potentially injure yourself. So those are, a little bit, it's kind of more minor, but you also have indications where if we're doing something with like an electrode or ultrasound where that's actually using electricity, indications could be you have an area that you need to incorporate more blood flow. Contraindications for that would be if the person has something like a pacemaker, that can actually affect the pacemaker's function. So that would be a contraindication, which is definitely much more serious because pacemakers allow for someone to have a normal heart rhythm. So if we're talking about paraffin bath is a type of heat therapy. It increases circulation. If you've ever gone to maybe a nail salon, sometimes they will put they'll dip your hand in wax and then they'll put it like in a little baggie and it feels good because it's warm, but it also like softens your skin. Similar to that is in physical therapy clinics or some athletic training clinics, they have these things that are just like a pool of hot wax and you dip your hand or body part in it. It's usually your hands or your finger. And you keep applying layers after it dries. And the purpose of this is just a type of heat therapy. So it increases circulation, which this would be used something down the line when someone's not in their inflammatory phase. It can help decrease pain. So again, if somebody has chronic inflammation, you might want to use this, not acute inflammation. If they're, suffering from loss of range of motion, you're going to want to probably apply some type of heat source so that it can help bring blood flow into it, loosen it up. If they have, this is subacute sprain and strain. So this would be if they maybe have a sprain or strain that's past that inflammatory phase, but it still is recently injured. And then your contraindications would be those acute injuries. If they're already still showing signs of inflammation, open wounds, infections, things like that, you wouldn't want to do because one, it's gross, and two, other people might use this wax. And so you're just eventually could potentially infect other people. And then if there's an open wound, that wax too is not probably very sterile, and that could cause infections in the wound itself. All right, so modalities in your inflammatory phase. So these, again, are directed towards making sure that you're limiting the swelling, you're reducing the pain, and then you can kind of try to increase range of motion, but again, they might not have much range of motion due to pain or the swelling. So that's where you can maybe you yourself push on, let's say it's their ankle, gently. You're not going to just like shove it, but push on it gently to kind of get that range of motion going. And then just making sure that whatever modality you're choosing, you understand what the effects are physiologically in this inflammatory phase. If we're talking about the repair phase, we are trying to increase circulation. You're still trying to obviously not allow them to suffer too much pain, but now you can try to start increasing range of motion. You can start your strengthening exercises if they have that range of motion ability. And then again, you're just making sure whatever modalities you're choosing can help with whatever your goals are. And then last one, this is your remodeling phase. So again, you're still trying to increase circulation. So that's where you want to probably use heat types of therapy. You're still trying to increase that range of motion, increasing strength. You're moving to more functional movements. And again, you're just making sure that you're choosing modalities that adhere to what the phases and the goals that you're trying to meet, and you're not using modalities that are contraindicated. All right, so we have 6 different types. Sorry, I can't do math, but 6 different major categories for your therapeutic modalities. You have your cryotherapy, so those are ones that are cold. You have your thermotherapy, so these are your heat therapies. You have your electromagnetic. So these are also types of heat therapy, but they are ones that use obviously electricity. You have your acoustic or sound therapy, another type of heat therapy, but it's using sound waves to generate energy. And then you have your mechanical. So this is where it's more hands-on, could be things like massage, chiropractic adjustments, things like that. And then you have your therapeutic exercises. So those are things where if you look at this bottom image, he is trying to do some scapular exercises to strengthen the muscles. Most likely has some type of shoulder injury. All right, so common cryotherapy treatments are going to be your ice packs, ice massage, which I have these in my training room, but it's very similar to obviously icing. You have that relief that ice gives, and it also helps to vasoconstrict your blood vessels, but it also has a massaging mechanism. So you basically just move the ice massage cup over that injury. And so you're having that pushing of the fluid via massage, but then also the cooling and vasoconstriction from the ice. And then a cold whirlpool would be another type of cryotherapy. Your thermotherapy, so you have your hydroculator pack. If you've ever come into my training room, just a fancy way of just saying a heat pack. You have your paraffin baths, which I have talked about. Those ones are where you're dipping your hand in. And then you have your hot whirlpool. So this is opposite of the cold one. It's just heated to a higher temperature. Your fluidotherapy. So this one is where, if you can imagine, this is a type of sleeve, and it has fluid inside of it. And so it mechanically like pushes the body part around. Kind of hard to explain without a visual, but that would be one type. And then your infrared, which would be like laser therapy. Again, another type of heat therapy. You have your electrical or electromagnetic. These are ones where you probably have seen the electrodes. So that is electrical muscle stimulation. I call it E-stim. You have your low-level laser. So it's basically a heated source that then promotes, again, heat to allow more circulation. And then diathermy, it's kind of like a microwave in a sense where you're heating around the area and it's just promoting, again, more blood flow, that sort of thing. You have your acoustic. So this is ultrasound. If you've been in my training room and maybe you have received it, you shouldn't feel anything with ultrasound. It's not the same thing as like a ultrasound that you would see for a baby. That one is using sound waves to project an image. This one uses sound waves to cause energy, and then that energy then is turned into a heat source. So again, it's promoting more blood flow. Phonophoresis is essentially the same thing. It's just that you would place some type of like topical gel. So let's say like a lidocaine gel, which is a pain relief gel, on the skin. And then you're using that ultrasound to push that medical product further into the tissue. You have your mechanical. So these are things like traction. So if you've ever gone to the chiropractor, maybe you've gone to physical therapy where they're actually like pulling on your joint, that can help to open up the space and to allow some muscles to relax. You have your intermittent compressions. That's where I was mentioning how you can have a sleeve where you have water in here and it's really cold and it pumps into the sleeve and it causes compression and then it relaxes, compression, relaxes. That helps with promoting, again, that pump. So if you do have any swelling. And then sports massage would be the last one. And this one is where, again, you're just receiving a massage. It's a little bit different than a therapeutic massage or one you might think when you're going to like a fancy resort. This one is a little bit more painful because you're really trying to break up any like scar tissue, or it could be that there's a ton of swelling. So that's a little bit different than regular massage. And then last thing are your therapeutic exercises. So you have your plyometric exercises where you're doing more jumping stuff. So if you've ever like box jumped, that would be a plyometric exercise. You have your aquatic exercises, the ones that are done in the water. These are typically used when somebody can't put full weight on the injury, but you still want them to still go through the range of motion. You can have your more stabilization exercises. So that's where you can have the person standing on one leg, like you can see in this picture, or maybe standing on the flat side of a Bosu ball, practicing their balance, which can also help with core stability. But you're also, when you're balancing, you're actually activating the little muscles in your joint to fire. And then you have your Swiss ball, tons of things you can do with that, but that is a Swiss ball. And then your Bosu ball free weight. So again, there's so many different things that you can use for therapeutic exercise. It can even be body weight as well. So depending on the person, the injury, again, you're going to choose according to that. Let's see. Last thing I guess I will talk about are soap notes. So these are just things where you're recording what it is that you think the person has, what type of treatment you're providing, what are your goals. So soap notes are things that you will see if you ever do plan on doing something in athletic training, maybe sports medicine related, physical therapy related, but you should have a plan for each patient. And these soap notes allow you to kind of write that stuff down. So you guys don't have to do that in this class, but it's just something that if you come into my training room and you see me like typing away or writing things down, one, it's to keep track of your injury, but two, it's also to pretty much plan for when I see you next. And this is just an example of it. So again, you're doing your symptoms, what's going on, history. Then you would do like all of your orthopedic assessments, which you guys will be learning that once we get back to hands-on stuff. And then eventually you would come up with your plan. So should they be icing certain times of day? Should they be exercising? What exercises are they doing? Should they be taking ibuprofen? And so forth. So if you have any questions, feel free to let me know. But if not, just make sure you're turning in your notes by the end of the period, and I will see you tomorrow.